Rheumatoid arthritis affects an estimated 1.3 million adults in the U.S. For those affected by this debilitating condition, day-to-day tasks can be a struggle, and if not managed effectively, can progressively get worse. Today, we will be discussing rheumatoid arthritis and what patients need to know if their RA is not under control. I'm Erica Vetrini. Access Health starts now. Dr. Grace Wright is a rheumatologist who has dedicated the last 25 years of her career to treating patients with this autoimmune disorder. I'm going to sit down with her in a bit, but first she explains the basics of RA.
Rheumatoid arthritis is an autoimmune disease, which means that your own immune system attacks your body. In this case, it's attacking the joint primarily, and it tends to attack the joints on both sides of the body. Some of the joints affected will include the hands, the feet, the wrists, the shoulders, the knees, the hips. The symptoms include pain, aches, morning stiffness, tenderness, swelling, and fatigue. In addition to that, rheumatoid arthritis can affect other parts of the body, such as the lung, the heart, various other tissues. This is a systemic disorder with inflammation everywhere.
RA can be incredibly painful for patients and affect their quality of life.
Whatever we do, we're using all of our joints, we're using our entire body. If you have painful, swollen, stiff joints, that impacts every action that you take. Patients also feel very isolated at times, both from their families, from their communities, because they can't participate in the usual activities. And in addition to that, anxiety and depression often accompany this disease.
When we come back, I'll meet with Dr. Wright, but first let's hear from Stephanie, who has RA.
I'm Stephanie. I'm 27 years old. I live in Miami with my husband. We've been married 7 years, and we just had a baby. I love being a mom to Santiago. He's so much fun to be around. He's the cutest thing in the whole wide world. When people look at me, they just see an average 27-year-old, but I'm living with rheumatoid arthritis. It's a roller coaster having RA. I never know how I'm gonna feel when I wake up in the morning. And it affects every part of my body, from my head to my toes. Morning stiffness, all day stiffness, nighttime stiffness. Just being any place for an extended period of time makes it really difficult. And it's sort of like a tin man feeling. It's like you can't get loose, you can't get limber. And it gets to the point where it causes pain. When my knees are swollen and painful, it's difficult to walk. And it's to the point that I don't even want to use the joint. So it's sort of like having an area of your body that's painful. You don't want to use it, you want to protect it, but that makes it difficult to do everyday things and tasks. Being a mom to a 6-month-old is hard enough, but having RA, it's a different level of tired. It's sort of like having the flu. I feel weak. And it's difficult because my mind feels 100% and I'm 100% there, but it's like my body can't keep up.
Coming up, life after diagnosis and the importance of managing your RA. Stay with us. Once a patient is diagnosed via their medical history, a physical exam, along with blood and imaging tests, doctors can start to create a care plan. I met up with Dr. Wright to better understand the collaborative approach to managing a patient's RA. Dr. Wright, thank you so much for having me here.
Oh, thanks for coming.
So let's talk about why it's so important for your RA patients to develop a relationship or a partnership with their doctors.
This is a lifelong disease. It's important to have lifelong relationships, to have a collaborative approach so that this is a journey both you and your providers can take together.
And so then why is proper management of RA so vital?
RA can cause joint damage very early on. 80% of patients can have damage within the first 2 years before they even realize that there's a problem. If we get effective management early on, we can limit joint damage and we can limit all of the other damage from inflammation as well.
So speaking to that, what are your treatment goals for your patients?
So the treatment goals really are tailored to each patient. But overall, we want to make sure that we improve your physical function, that we reduce your pain, reduce your fatigue, and really get rid of the tenderness and swelling in the joints that really impact your ability to engage in your daily life. You need to be able to get up in the morning, get ready, and go to work, and not take 6 hours for that process. That makes it very difficult. I also want to make sure that you're not having a flare every other day or every week, because it's really hard to live when you're always under the burden of this inflammatory condition.
So how do you identify when patients don't have their RA under control?
I look at how frequently are you flaring? How much has your physical function changed? Are you able to open the door? Are you able to get up and go to work as you used to? When things like that change consistently, then we know that things are not being managed appropriately. The other things that we have to look at are your blood work. We can see levels of inflammation in the blood. We can look at imaging studies, things like x-rays and ultrasounds and MRIs that show us the structure of the joint and will help me know, are you forming erosions, which is little holes in the bones that occur when the inflammation really targets those cells and damages those structures. So there are lots of tools that we have to use, and it's important for us to take a look at the whole picture.
So it's good to know that there is hope.
Oh, absolutely. You have to have hope. And when patients come in, they're often just sort of thinking, my life is over, I'm never going to function the way I used to, I never get back to normal. My job is to help move you towards that path of normalcy. It's important to always understand that control of your disease is important. Therapies may work, they may stop working. Your doctor needs to know what works for you and what doesn't work, and really get a care team together that's going to support you throughout the entire time.
On that note, let's go meet Carla, a patient living with RA in Dallas, Texas.
I've always been an adventurer and I love to travel. I've always been active. Cooking is one of my great passions, and I still enjoy that, as well as more sedate things like movies, and I'm a devourer of books. I work in corporate communications, which allows me to work on some very interesting projects that range from marketing to executive speeches to videos to website copy, and it allows me to stay active and be engaged with very interesting projects. I kept getting these weird symptoms. Sometimes the symptoms would range from just an ache or a pain that would appear for no reason. I would have strange rashes that the dermatologist didn't know what was, the allergist didn't know what was, but they would, go away with some anti-inflammatory treatments. And these would continue on and then go away over a period of probably 3 or 4 years. I wasn't sure what was going on until I had a really bad flare. My elbow blew up to the size of a grapefruit. But more than that, I started to continue to have all over, problems with my joints and morning stiffness and fatigue. And that, I think, gave the clue to my orthopedic professional that something more systemic was going on. So I was referred to the rheumatologist, who did diagnostic tests and did confirm rheumatoid arthritis as my condition. But I'd been having joint damage, and just 2 months later, I had to have a full hip replacement, and 6 months after that, I had my first shoulder replacement. It was a devastating time in my life, first to deal with the diagnosis and understanding what that might mean in the future, and then to go through 2 major surgeries in such a short period of time. It completely turned my world upside down.
Welcome back to Access Health. We're talking rheumatoid arthritis with Dr. Grace Wright. Doctor, tell me, when as a physician do you become concerned that the current treatment plan isn't right?
So if I see that, for instance, the drug is not working fast enough, it's been 6 months, it's been 9 months, and they still have the same amount of swelling and tenderness, the blood tests are still showing high levels of inflammation, it may be time to switch therapies. But I need to first step back and say, what have you tried before? What's worked? How long has it worked? Is it because of side effects that you've sustained, or is it because the drug didn't actually work for you? Do you need diet, exercise, just really all of those things put together to make sure that we're controlling the disease and moving you towards a state of wellness and health.
And no two patients are alike, is that true?
I have yet to see two identical RA patients. Everybody has their own journey. They have their own other medical history. They have their own functional issues. I have to work with everybody as an individual.
So then, doctor, what are the treatment options?
So fortunately, we have several treatment options available to us today, and I'll talk about them in classes. Many people come on an anti-inflammatory, so a non-steroidal anti-inflammatory, like the ibuprofens and the naproxens of the world. They start off with that because you're swollen, you're stiff, and many people start there, or they may be on pain medicines, which really just work on symptoms. They don't actually work on the disease. When we talk about targeting the disease, there are classes of drugs that we use, and we'll talk about something called DMARDs, or disease-modifying anti-rheumatic drugs. And those start off mostly as pills, and some of those can be injections, but those help to first start to target the underlying disease. And then we have targeted synthetic DMARDs, a newer class of agents which work on specific pathways. And we'll think of those like the JAK inhibitors or the Janus kinase inhibitors. They inhibit pathways within the cell that are driving inflammation. And then the large class is the biologics. Biologics are proteins in general, and these target either cells or the chemicals in the blood that are driving inflammation. So two of the cytokines that we target with our therapies would be TNF, or tumor necrosis factor, and IL-6, or interleukin-6. Both of these are elevated in patients who have rheumatoid arthritis, and by restricting and limiting and sort of rebalancing those levels, we can also limit that inflammatory response. With interleukin-6, we know that it's enriched inside the joint, and so by limiting and inhibiting the IL-6 pathway, we can help to decrease the amount of inflammation and again restrict joint damage and a lot of the functional issues that patients have. So there are lots of choices, and it's important to have a discussion with your doctor about which choice is right.
So doctor, what are the concerns that patients may have in regards to their treatments?
Sometimes it's as simple as saying I'm nauseous with taking a drug, or my hair is thin, or something makes me feel unwell, and those are concerns that you should really communicate with your provider. When I think about other concerns with some of the drugs we have, some of them are given as injections, and there may be burning or redness at the site. Some are also given by intravenous infusion, which is putting an IV into a vein. You're sitting in an office getting that infusion. Some of my concerns for patients include some of the side effects that we're worried about with our drugs. So we're always concerned about the risk of infection that a particular patient may have or that a drug may predispose them to. We're concerned about malignancies. We're concerned about the heart. Some people already have cardiovascular disease, and so we have to be careful with all of those things. So again, it's a conversation about not just being effective as therapists, but also being safe for you as a patient.
Thank you, doctor, so much. Now let's check in with Carla and Stephanie to see how they're managing their RA.
I was having difficulty managing my disease. I still had a very full professional life and a very full travel life, but eventually, even working for myself, it became impossible for me to work full-time. Just getting up in the morning, getting ready, and driving to work, I was so exhausted. By the time I got to work, it was difficult for me to work. Then if I would have a flare, and you never knew from one day to the next how you're going to feel. And I wound up retiring earlier than I thought I ever would. But that gave me the opportunity to take a couple of years off and just focus on my health. The diet, the exercise, the things that I could control. One of the key parts of managing my condition is the great relationship I have with my rheumatologist. I actually fired my first rheumatologist who diagnosed me because I just couldn't relate to him. But now I found a doctor that treats me as a whole patient. We collaborate on my health care and talk about what the symptoms are and what new things are going on in your life and what is working and also what's not working, so you can get the best plan in place for bringing my life back to a level where I could once again enjoy those things that I enjoy that are important to me, like working part-time, traveling a lot, and enjoying life with my husband.
I was at an age where I had my whole life ahead of me. I had a rheumatologist before who literally saw me walking around with crutches because my knees were hurting so bad. And he told me to my face, "You'll probably never work a day job." I was lucky that I was at that appointment with my husband, who is a great advocate for me, because in that moment, I felt completely defeated and I didn't know what to say. And my husband just said, "How dare you?" And we stormed out of there. I had an aha moment that being an advocate means advocating for your own health and being a contributing member of the medical team. When I see my rheumatologist, we talk about my treatment plan, and being a patient advocate to me means being vigilant about how I'm feeling. If I'm using leggings a lot because zippers are getting hard for me, or if I'm brushing my hair less often because my hands are swollen, I'm communicating that to my doctor so that we can manage my RA symptoms in the best possible way and make sure my RA is under control. And we decide together whether it's time to switch therapies. I can tell when a therapy is working when there's less fatigue throughout the day, and I have the energy and the ability to do more because I'm in less pain. This is my body, this is my life, and I have to live with it.
Welcome back to Access Health. We've been learning all about rheumatoid arthritis with Dr. Grace Wright. Doctor, before you leave, do you have any last takeaways for anybody who's watching today?
If you have symptoms that are persisting, unchanged despite therapy, speak up. We have other choices for you to help manage your RA more effectively. And most importantly, never lose hope. There are choices, there are ways to get us moving back towards health and wellness.
Doctor, thank you so much for your time. Speak up and never give up hope.
Absolutely.
Stephanie and Carla are perfect examples of patients that are thriving despite their RA.
It's hard for me to think about blessings that RA has brought into my life, but connecting with other patients and helping other patients through my advocacy work is one of the great joys of my life. That advocacy work has opened up a whole new world of fulfillment for me that I didn't have before when I was an 80-hour-a-week professional. I have a marvelous, what they call a new normal. I'm able to enjoy all of those things that are so important to me and feed that adventurous spirit of mine. Having rheumatoid arthritis, it doesn't mean that life stops. There is hope. There is the ability to continue doing those things that bring you joy and make your life worth getting up for every day.
Having RA, my life journey is different than the average 27-year-old. I move a lot slower, and sometimes I get down on myself for not being able to accomplish everything that I aspire to accomplish. But then I remember the story of the tortoise and the hare. And in the end, the tortoise always wins. And that's how I see myself going through life with RA. I will get to it, and I will accomplish my goals and my dreams. It just may take me a little bit longer.
I want to thank Dr. Wright for her time today educating us on rheumatoid arthritis. If your RA is not under control, speak to your doctor today about options to more effectively manage it. A special thanks to Carla and Stephanie for sharing their stories. For more information, please visit readytoactra.com. And for more helpful information, you can always visit our website at accesshealth.tv. From New York City, I'm Erica Vetrini. We'll see you next time.